What people don't realize, again, with this COVID-19 pandemic, is that your oral health is very important. A lot of bacteria, viruses, if you have gum disease, it will get into your gums and it will get into your system, and it can affect your heart. They have links to heart disease and gum disease. They have links to diabetes and gum disease. They have links to Alzheimer's disease and gum disease. And if you had a cut on your arm that was 6 inches long, you would get that bandaged up. Well, think of your gums. If you don't take care of your gums, that's a cut 6 inches long in your mouth. And where's the best place for bacteria on our bodies? It's in our mouth. It breeds there. It's going to get into your system. I had several patients just recently, again, through the COVID thing, that had to come in because they needed heart valve replacements. They had to get cleared, a dental clearance, before they could have their heart valves taken care of, because when those doctors are going to replace their heart valves or do major heart surgery, they don't want any infections to spread to what they did. And so before they could get clearance, they had to get their mouths cleaned up. And they were afraid to have their dental work done. But because I provide sedation dentistry, not just numbing their mouth up, I was able to put them to sleep, clean all the tartar and everything off their teeth and under their gums, and get their gums healthy again. So now they can go have those procedures. We don't think of our mouths as part of our body. We think, oh, they're just teeth. But there's a dynamic there between our whole body, our mouths, our teeth, everything. It all works together. Also, I've had patients who needed to have kidney transplants. Also, again, their doctor wasn't going to touch them until their mouths were clean, and I had to go in and put them to sleep and clean all the tartar and stuff off their teeth. I had to take out their bad teeth, clean the infections out of their mouth. So when they had their kidney transplants, they were going to heal well, because they didn't want the bacteria from their mouth to infect that. The sad thing is, though, is when patients find out that they need to have these things done and they let their mouth go, now they want to have it done right away when all this stuff is built up, say, over 5 or 10 years. And you really need to, take care of your dental health. Every 6 months, go in for your cleanings and stuff. It's a lot easier, it's less expensive, it's easier to get done, it's more efficient that way. But there are things for people who are nervous and afraid. I've had a patient who had to have his knee replaced a second time because he was not taking care of his mouth, and the infection came, from his mouth. So these are important things to consider, especially when people are afraid of catching COVID. You need to consider your whole health, because it all works together. You have gum disease in your mouth, it's going to lower your immune system. It's going to affect the rest of your body, and you're more susceptible to catching COVID or pneumonia or the flu or these things. So that's why oral health is really important. So that's part of the reason why I have a passion for it, because when I see these things, again, you might consider, hey, I got to lose weight, but you don't take care of your gums, or I've got to do this or that, but it all ties together.